Internationally educated nurses, IENs, face several challenges when transitioning to practice in Canada. Understanding these challenges and adopting effective strategies can significantly help them succeed in their careers. Here's an overview. Challenges faced by internationally educated nurses in Canada. 1. Credential recognition and assessment. IENs must have their qualifications assessed to ensure they meet Canadian standards. This process, managed by the National Nursing Assessment Service, NNAS, and provincial regulatory bodies, can be lengthy, expensive, and sometimes confusing. 2. Licensing exams. Nurses must pass the NCLE-XRN for registered nurses or the CPNRE for practical nurses to be licensed in Canada. These exams may differ significantly from those in other countries in terms of content, language, and format. 3. Language proficiency. Meeting English or French language proficiency requirements is essential. Many IENs face challenges with medical terminology and communication in a clinical context, even if they are generally proficient in English or French. 4. Adapting to the Canadian healthcare system. The Canadian healthcare system, policies, and workplace culture may differ from what IENs are accustomed to. This includes patient-centered care models, electronic health records, interprofessional collaboration, and different scopes of practice. 5. Workplace integration. Adapting to workplace culture, including understanding the roles and expectations of colleagues, communication styles, and dealing with potential discrimination or bias, can be challenging. 6. Financial and emotional strain. The process of relocating, licensing, and preparing for exams can be costly and time-consuming. The stress of navigating a new country and healthcare environment, combined with potential separation from family, can be overwhelming. 7. Finding employment opportunities. Even after obtaining licensure, some IENs struggle to find jobs that match their experience and skills due to a preference for Canadian experience, perceived gaps in training, or other biases. Important tips for success for internationally educated nurses in Canada. 1. Understand the licensing process. Start by thoroughly researching the NNAS and provincial regulatory body requirements. Plan for the time and costs involved and seek advice from other IENs who have successfully navigated the process. 2. Prepare for the licensing exams. Consider taking preparatory courses or workshops tailored to the NCLE-XRN or CPNRE exams. Utilize practice questions, review guides, and join study groups to build familiarity with the exam format and content. 3. Improve language and communication skills. Even if you are proficient, enhancing medical terminology and communication specific to the Canadian context is crucial. Consider taking language courses, particularly those designed for healthcare professionals. 4. Gain Canadian experience. Volunteering, internships, or taking bridging programs can help build local experience and understanding of the Canadian healthcare system. Many employers value Canadian experience, which also provides networking opportunities. 5. Join professional networks. Engage with nursing associations, such as the Canadian Nurses Association, CNA, local regulatory bodies, and community organizations that support IENs. These networks provide valuable resources, mentorship, and job opportunities. 6. Adapt to the Canadian healthcare culture. Take courses or workshops on Canadian healthcare standards, patient-centered care, and cultural competency. Understanding and adapting to local professional norms and expectations is key to integration. 7. Seek mentorship and support. Connect with experienced Canadian nurses or other IENs who can provide guidance, share experiences, and offer advice. Mentorship programs and peer support groups are beneficial for navigating challenges. 8. Stay resilient and positive. The transition can be challenging and may take time, but staying positive, resilient, and persistent is crucial. Celebrate small milestones and remember that every step brings you closer to your goal. 9. Consider alternative pathways. If you face challenges with licensing, consider alternative pathways within healthcare, such as roles in community health, education, or research, which can still utilize your nursing background and skills. 10. Stay updated on policies and requirements. Regularly check for any updates from regulatory bodies, as policies and requirements can change. Staying informed ensures you remain on the right track. By preparing thoroughly, seeking support, and staying focused, internationally educated nurses can successfully transition and build rewarding careers in Canada.